quindi abbiamo 11 diversi enzimi che producono 13 diversi fenotipi MPS. Il fattore comune per tutte le MPS sono le elevate concentrazioni nelle urine di GAG. E se analizziamo l'urina possiamo quantificare il GAG totale e identificare quali di essi sono elevati. Questo ci darà un orientamento abbastanza chiaro su quale enzima dovremo studiare. La determinazione del GAG è molto più economica dalla quantificazione enzimatica. Abbiamo preso in considerazione la possibilità di affrontare la diagnosi di MPS misurando la concentrazione di GAG nella carta impregnata di urina e attività enzimatica in DBS confermati nei leucociti. Well, thinking that GAGs is the main goal for our project, we developed the FIND project. The FIND project, what is it? It's a tool. It's a tool for all of you, for all pediatricians. You may interpret this like a tool for you. You have a problematic baby. You don't know what is this, but in a single consultation, you may take a sample of urine and blood and send by normal mail to one reference lab. This screening is based on symptoms. It's for clinical use. So all our dialogue is only with physicians, no with patients. The dialogue is between the lab and the physician. And how it began? Began as a collaborative project in 2014 between the MPS Spain Association and our lab, and now has the endorsement with different societies. Our objective was to demonstrate the validity of urine samples in order to perform early diagnosis of MPS. Of course, those that have a valid and approved treatment are the main goal, but we can detect the other ones. And the second objective is to establish an economical and viable method for the early detection of those MPS and provide evidence to health authorities. Like in Italy, the health authorities want proofs and want evidence. This FIND project put evidence in their on their tables to evaluate if it's possible the newborn screening. The diagnostic algorithm starts in the doctor's office. Under a clinical suspicion, they recall a kit. We send that kit with all the informed consent, the analytical tools, etc., and we quantify urine GAGs. Actually, we receive urine and blood, and only blood. So we are open-minded. The important is to establish a diagnosis. As before has explained, they are clinical keys, but please pay attention. The success of the accurate diagnosis is not the typical MPS with the hand and claw, the short stature, and the causal phases. Please pay attention, for example, in a baby with an early carpal tunnel syndrome. A child with early carpal tunnel syndrome is very, very, very rare. And the recurrent otitis, or talking before about inguinal hernias, etc. Of course, the other main characteristics of this disease. We may detect the urine using the classic method, that is the DMB method. Is very, very cheap. And my surprise is why it's not implemented in some countries that don't have the MS SPECT technology. And please take in account that the GAG's concentration varies according to age. And it's important to participate in indicating the age of baby to adjust this. There's another cheap method. This is one-dimensional electrophoresis, where you may identify the type of GAG is presented. This is oriented very, very well in which enzyme we must study. Of course, we cannot detect by GAGs the difference between 1 or 2 MPS, But if you only find heparan, for example, you are with San Filippo clearly. Now we perform the MS spectrometry that is more accurate and, of course, more robust. In the FIND project, in these 5 years, have participated the whole Spain. More than 822 pediatric patients has been recruited, and including the islands and the cities from the North Africa or Ceuta and Melilla, that you know are part of Spain. We have detected 37 cases of MPS, 8 cases in red for MPS 1. This one in Las Palmas was recruited by a pediatrician in primary care. 8 cases of MPS 2. This one in the north, I think that this is in Canary, and this one has been detected also by a primary care. 80% of patients approximately comes from hospitals and 20% from primary care. 9 cases from San Filippo, 5 3A and 4 3B. 8 cases from Morquio A, 4 cases for Marotolami. The main signs and symptoms presented by positive cases was skeletal, of course, and facial, because are the most important, but retardation, growing retardation and mental retardation, the otitis, the organomegalis, in one case has a familiar history about MPS. This is in the tail case, the values of GAGs obtained in paper, okay? No in liquid, only in paper. And the activity blood in DBS or in leukocytes when we confirm. Unfortunately, not all the cases has sent us liquid samples. It's for that I presented. The most important is all of them has a very, very low activity, very, very low. And it's important to detect cases that classically we understand that the MPS 1 and 2 has very, very high levels of GAGs, but it's not correct. They may be very close to the cutoff. Almost the 80% of cases has 5 years old or less. And we consider this a very, very success because we have advanced in a detection very early. If we compare our study with other published, this is our rate calculated. It's a little lower. So probably the participation was not very, very good. We perform a little more participation in the future. This is the distribution of cases pending the diagnosis, and it's very close to other European studies. This study of Netherlands don't divide the MPS 3A and B. Taiwan has more cases of MPS 2 than Europe. And in the East, Malaysia and Emirates has more MPS 6. And we have not detected any case of MPS 7. The most impacting in LSD diagnosis was the lowest age, the median age, at the moment of diagnosis of these diseases, before and after the FIND project. In conclusions, results of FIND project show that urine GAG determination is fast, simple, and reliable technique that allows an early diagnosis of MPS. We have recalled a liquid sample in 6% of total samples received. The implementation of LC-MS technique allows a more reliable screening, avoiding unnecessary recall samples. And the MPS global incidence in Spain is 1.5 cases, probably underestimated due to voluntary participation. MPS 1, 2, and 4 seem to be the most prevalent, followed the MPS 3A, 3B, and MPS 6.